Hi, everyone. We have Kimberly Pratt today with us, and Kimberly did our first interview back in April, and so we are circling back to check in with her here in December and wanted to ask Kimberly some questions about how the past 8 months have been for her. And so I'm going to let Kimberly share with us remind us the work that you do, and then I'll ask you some questions. Thanks.
Thank you. It has been a whirlwind since April. So I'm in the mental health field, and I primarily do suicide prevention and postvention work. So supporting people and communities, preventing suicide through trainings and education and awareness campaigns, and also providing support for people after they've lost somebody to suicide. And then just some general mental health work is what we do. Yeah.
Thanks, Kimberly. Well, I wanted you to have an opportunity to share because I can imagine that this 8 months has brought so much that you would not have expected. Maybe some positive things that you've experienced as well. And so I wanted to start out by asking you, what has changed for you just in relation to your work? And you can share with us whether everything's gone virtual or whatever comes to mind.
Yeah. So for me, personally, I've had a lot of change. I went from one organization in one county to another organization in another county. And just like the way that we do work in both counties has changed exponentially, I think, as it has for everybody. Because so much of our work is community focused, everything that we've done up until COVID hit was face-to-face, in-person community meetings, community trainings, awareness events, tabling events, everything was person facing, forward facing. And now everything is on Zoom. So today, for example, I have back-to-back Zoom meetings. I'm on one Zoom meeting after another Zoom meeting till 6:00 tonight. And that has been a real struggle. I was talking with a coworker just last Friday. The work that we do is so heavy sometimes, and sometimes we just need to pop into each other's office and sit down and like debrief what we experienced or what we're working on, and just walk into your coworker's office and sit down for 15 minutes and kind of unload the heaviness of the job. And that doesn't exist anymore for us. There's not a quick and easy way to just like have a pop-in Zoom meeting. And so that has definitely been a huge change for the mental health of the mental health providers, of community organizers. Just not being able to have that in-person human connection has been probably the biggest thing that I've noticed. And so much of the work that we do is relationship building, and it's getting to know people, getting to know what they're working on, getting to know how they're working. After somebody dies from suicide, being able to be in the home with somebody to provide that emotional support, that looks really different. We still get called into the homes sometimes when it's really needed, and other times it's phone conversations or Zoom conversations. And as you can imagine, that's really difficult for somebody who just lost a loved one. So it has changed the way we do everything. Community events, learning to navigate how to host an event for 300 people online has been quite the adventure, if you can say that. It's been a big shift for the way that we do that, and finding ways to keep people connected when they have like Zoom or screen fatigue has also been a real challenge. We've seen kind of the ebbs and flows of that, where people are more willing to engage, and then after a few months we have like really low attendance rates, and then people will kind of come back. And so it's kind of cyclical in the way that happens. So it's just, it's been rough, I'd say. Yeah.
So Kim, what have been your best coping strategies personally?
So for me, I don't have kids, and so I think that has actually been maybe a protective factor for me. I have nieces and nephews, and my brother and sister have, man, they're much more limited to the things that they can do because of their kids. But for me, I spent the summer backpacking. It was like one of the few things that we could do that was safe, that gave us a mental health break. And so myself and two of my friends, we spent the entire summer from like late April all the way to mid-September. Every weekend we were out backpacking, and that was really good for me, for my mental health, because it allowed me to unplug from the week of being stuck in front of a screen all day. And that was really the best thing that I did for myself. It was really, really helpful for me.
So now that it's wintertime, have you found new coping strategies?
Quite honestly, no, I haven't. And it's been hard for me. It's because it's wintertime and it's dark early. It's been rough. I've engaged more in like personal therapy, so meeting with a therapist more regularly. Gyms are closed down, so I couldn't go to the gym. Like trying to find times to spend time with my dog. I think one benefit of the Zoom experience is that if I can find that time in my day, because I'm at home, I can take an hour in the middle of the day and go be outside and be with my dog and not kind of be stuck here. But the winter has provided quite a challenge for me, honestly, and for my mental health, and just trying to find other ways to decompress and relax. I've done a lot of baking. So that's been that's a mindful activity that I've been able to do, like decorating Christmas cookies and stuff. But then it's like, where do you even get to take those, and who can you give them to? So I'm just eating all of my own Christmas cookies, which I don't know, that could be a positive or a negative. But it's definitely been, I mean, like, all joking aside, winter has definitely been a lot more difficult, and numbers rising. I don't have a better word than difficult or tough. Like, it's just been hard in the winter for me.
So how is morale at work? And have there been any steps taken to keep morale up?
Yeah, I think, man, if we're being honest, which I think is important, especially for a project like this, morale is low, but not, it's the upside of being in the mental health field is that we can talk very honestly and openly about the emotions and experiences that we're having, and there's a lot of support around that. And I don't know if that's true in other organizations or other demographics, but definitely in the mental health field. I mean, we start every meeting, most meetings, with a check-in, and everybody just gets to say how they're doing and how they're holding up and what they're doing to continue to hold up, and that's how that coworker that I was talking about, he said, man, I am burnt out. I just checked in with my boss, and my boss was like, you're super burnt out. And so we spent the first half an hour of a meeting that was a community meeting, just checking in with one another, because we know how important that is, to be able to share our difficulties and be able to validate those experiences, and to know that we're not alone in those experiences. So even though it seems like people are having a more difficult time right now, I also think that there is great benefit of being able to say that openly and honestly. And so that has definitely been an uplifter, to be able to be in a space, in a workspace, in a work environment where people can say, man, I haven't done anything but sit in bed and watch Netflix and eat cookies for 2 weeks. And people are like, oh, me too, and that on its own is really powerful. And so to have that kind of supportive workplace, I think is really helpful.
how has this changed career goals for you or your coworkers? Have you had folks
Yeah.
that have considered or have left the field?
I don't know that we've had people who've left the field, but I definitely know that they're having a hard time filling open slots that were already there or finding people to come into the field. We've seen a lot of stagnation. So I'm at a new organization now, and we have a lot of young employees that are brand new in their career, and 75% of them are in grad school right now, or they were going to go to grad school and they stopped because they didn't want to do graduate level work online. And so they all, like, of the 75%, I would say, wow, this is not great. My math is terrible, but a big chunk of them put their academic careers on hold because they didn't want to do graduate level work online. For me personally, I got licensed during the pandemic. It didn't actually slow me down. In fact, we had so much, mental health is so needed right now. There was so much more time and space for me to get clinical hours. And so I was able to get licensed during this time. And in my field, specifically suicide prevention work, we're getting more and more money from federal levels and state levels because we are seeing such a high increase in mental health issues, not necessarily suicide rates. We don't have any accurate information to say that suicide rates have increased in 2020. There's no measurement out there that can give us an accurate picture of that right now. But what we do have accurate measures of is increases in depression and isolation, substance use. So we know that people are being challenged with their mental health, and that has created an even bigger need for mental health workers from the bachelor's level to the graduate levels. And so, but being able to fill those positions when we don't have new folks coming into the field has definitely been a challenge for us.
So I really appreciate you sharing that. And I wanted to talk a minute about suicides, because we would be interested, since you are a professional in the field, where do you get your information and is it up to date?
Yeah, so we get our information primarily from 3 sources. So we get it from the CDC, so National Reporting System. We get it from the Office of Suicide Prevention, which collects all of their data from the coroners in every county. And then we get it locally from our coroner's office. And so, yeah, those are the 3 places that we collect our data from. So we've been all year long have been hearing stories about suicide rates increasing. And for me, as a suicide prevention professional, I'm always wanting to make sure that our community is kind of looking, where is this information coming from? How are we getting it? And also to take a snapshot. So most of our data, we, like, for 2020, let's say there wasn't a pandemic in 2020, we still wouldn't have 2020 suicide data until the middle of 2021. And so for anybody who's saying we have accurate suicide numbers for 2020 is something that I'm gonna question, honestly. Where is that information coming from? And even so, if we're taking a snapshot of 1 year, that's still really hard to know why did it happen? What was it related to? Was it because of COVID? Like, that information is really difficult. And with suicide specifically, what we know is that suicides don't happen for one reason. There's not research to show that. And maybe that changes during COVID, but we don't know, and we can't accurately measure that. And we won't be able to accurately measure that for at least another year. Usually it takes like 3 to 5 years to have a real solid idea of what that data looks like.
So when you talk about the uptick and the increase in people with mental health issues, what are the top 2 or 3 reasons that they're sharing with you about what their biggest concerns are right now?
Yeah, so what we're seeing right now is we're seeing a much higher rate in depression, anxiety, substance use, and isolation. And all of those things, the information that when I say we, I'm talking about like national surveys, statewide surveys, things like that, and then anecdotal local information. So we don't have like a solid survey across Glamour County or Weld County right now to measure people's mental health, but we have like national polls and things like that. And people are definitely talking about the pandemic being the primary reason for increases in depression, anxiety, isolation, and substance use. And then like things that are ancillary to that. So loss of employment or food security issues, or, you know, all the things that have happened as a result of the pandemic. The election year has been really, really hard. The Black Lives Matter movement has been a struggle. No matter what side of the aisle you're sitting on, this has been a really heavy year for a lot of people. And so all of those things compounded are the reasons that people are giving for the increases in these other issues, mental health issues that we've heard so far.
So that's really good information. Thank you. It's so good to talk to someone that's, you know, able to articulate, you know, what is real, what's going on. And so I appreciate you sharing that. So what would you say, knowing what you know now, is there anything that you wish you could have done differently earlier?
Wow, that's a tough question. I honestly don't know how to answer that. Things that I could have done differently. I mean, maybe where my brain went was like, what kind of self-care could I have done to like preemptively prepare myself for this stuff? But I don't know that there is too much. And to be fair, I feel confident in self-care practices because I'm in the mental health field and I've really worked to develop those in myself. But something that I've definitely seen, and this is without judgment that I say this, that I've seen just like in family and friends, is wishing that they had more, maybe better self-care practices and mental health practices. I've seen so much, you know, people ask us a lot about how are the kids doing? How are the kids doing? And honestly, everybody is kind of struggling. Everybody is, no matter what age you are. But one really big indicator that we see is that our kids are doing about as well as their parents are. So if their parents are struggling, those kids are struggling more. And that's not true. That is not a blanket statement. That's not true for everybody. But what I wish we could have done, like just community-wide or nationwide ahead of, if we would have known differently, was make sure that our families had built-in coping skills, built-in self-care, built-in, like I would have loved to have like a really just like strong, mentally healthy community, because we are really limited on what we can do to keep people physically healthy during this global pandemic. But we could have worked on bolstering people's mental health to help support them through these other experiences that they're having. So I mean, but that's a huge, I don't even know. That's a big 10,000 foot picture of what we could have done differently.
Well, thank you. That's great. It reminds me that, you know, in places like San Francisco, where they know that someday they will have a hurricane or a what's it called when you
earthquake,
thank you. And so they actually have local agencies, especially the fire department, that do trainings to community members on how to prepare. And if you want to, you know, be a volunteer when we have the earthquake, then these are the skills that, you know, we're going to train you for. So they know it's going to happen someday.
Right.
And so I appreciate you sharing that for a pandemic, that's really important for everyone to have those coping skills, right?
Right. Well, and I love that you point that out because we have disaster preparedness trainings. We have built-in systems for physical safety.
Mm-hmm.
Those just don't really exist for mental health. They're not,
Right.
I mean, certainly not at the same level or with the same amount of funding. Like that's just not a thing. And I always think about the reduction of stigma. There exists in Colorado support lines for people who have been affected by COVID, who need mental health support. And while our crisis numbers have been up, our support line numbers for COVID, at least in Northern Colorado, have not been what we expected them to be based on the crisis numbers being used more based on the surveys that we're getting about people's increased depression and anxiety and things like that. So maybe we need to find different ways to connect to people and to support people. But again, in a pandemic, when we can't be face to face with people, that's really hard. And so how do we get people to use those crisis lines? How do we get people to hop onto a Zoom meeting when they've been on Zoom meetings all day and encourage them to do some like debrief when they're like, I just can't take another Zoom meeting. And so it's been a real challenge. And maybe one thing we can learn from this whole thing is how to engage people better through, electronics in a way that doesn't give them that fatigue, that screen fatigue.
Exactly.
Yeah.
So do you have a story that you would like to share that maybe sums up an aspect of these difficult times from your perspective?
Yeah. I think I kind of already shared it, and this is really just off the top of my head. But on Friday, I met with this coworker, and we were in this team meeting, and it just seemed like this kind of sums up what my experience has been like in the mental health field doing community-based work. So I'm not doing clinical direct client-to-client care very often. Like that's pretty rare for me, but community impact, collective approach care, where we all sit in a Zoom meeting together and everybody does a check-in, and we realize that everybody is struggling so much that the actual community work that we're trying to get done, the tasks that we need to do, are so much less important than checking in with the people on the call, because these are the people that are doing the direct service, that are doing the direct care. And I feel like that experience has happened to me so many times I couldn't count, that we've been on a call with mental health providers or community providers, and we're saying, how's everybody doing? And the answer is not great. And so we're like, okay, well, let's redirect this meeting. And what does that look like for you? And what do you need? And it becomes this like place for these mental health providers to just debrief the experiences that they're having while they're supporting other people, and then to see the burnout that they're experiencing, and then to feel a little bit helpless, and then have this check-in, and then feel a little bit better afterwards. Like all of it feels kind of impossible, but also collectively like really great that we can come together and have that experience and prioritize our people over our projects. And I think that is a really just classic example of what I've experienced for the last 9 months, really.
This is so powerful. Yeah, very powerful.
Yeah.
And so that's what you're trained to do, right?
Yeah.
Just
people first.
Unexpected, but yes, that's how you use what you've learned, and here we are.
Yeah.
Well, Kimberly, this has been so great, and I just want to know if is there anything else that you would like to share with us or tell us that you want the listeners to hear about this very difficult time?
My last message, which is probably always my last message, no matter what, is mental health matters. And if it's a crisis to you, it's a crisis to us. So please reach out to your mental health providers, your crisis centers. Like there are so many people out there who want to listen and support, and they might not be able to fix any financial situation you're in. They might not be able, I mean, nobody can cure that. Well, maybe somebody can. We can't cure the pandemic. But what we can do is support you through it. So reaching out for that mental health support, I think, is just an invaluable resource that I want people to utilize as much as possible.